Started with Dr. Helen and Pelvic Health. I just want to introduce Spectra Spray if you haven't been on with us before. My company, Spectra Spray, is a women-owned and operated business. We do everything we can to support women with education, oral sprays for sleep and stress and energy, and they're really, really great to use for the whole family because they're dose adjustable, and they'll even help the immune system. We have vitamin D sprays, D with K2, and we also have things for stress support. We have some new hand sanitizers, and we also have a special Folate Plus that we're going to talk about a little bit later. So while we're waiting for Dr. Helen to get on, she should be on in a minute. Guest requests. I'm sorry, we're just waiting. I'm going to tell you a little bit more about our Folate Plus, which is perfect for women, but it's also really, really great for heart health. This is our Folate Plus, and a lot of people don't really know that folate is called B9. So in this spray, we actually have B6, B9, and B12. And the dose of the B9 is adequate for women who are pregnant, and it's also adequate for those with heart health issues that want to support their folic acid or their folate. We typically pair that with the vitamin D with K2. We call that a heart health kit, but it's also very, very good for pregnancy and anyone who's trying to get their D levels up, because the K2 helps you absorb the D properly and helps the calcium absorb so that you're not calcifying your arteries with the extra, with the calcium not going in the right place. It could calcify your arteries. So these sprays are also really good for mental health. A lot of people don't always think about B vitamins for either concentration or energy or just general cognitive decline. As we get older, a lot of the B vitamins are not able to produce as well in the body, so we need to take them. As they say, if you can't make them, you need to take them. Here she is. Okay, we're going to get...
Hello.
Okay, there she is. Hello, Dr. Helen.
Hi.
How are you doing tonight?
Good. Sorry, I don't know if you've been on for a couple minutes. I think my page didn't refresh properly, and I was like, "Hi, everyone."
I got on, and then I ended up canceling and starting over, so I thought I might have lost you.
We're here now.
Welcome. Yeah, here we are. I want to introduce Dr. Helen. I already gave everyone a little intro into the spray vitamins.
Awesome.
Tonight, we're not focusing too much on that because I'm so honored to have you as our guest to be able to teach these ladies about some really personal issues and how they can deal with them more naturally. Things like, you know, bladder incontinence, urinary incontinence is more the official name, and actual pain in the pelvic area, whether it's postpartum or during pregnancy or even as we age, like me. I luckily don't have that issue, but I know a lot of women have various issues that could cause painful sex and also just uncomfort when you're trying to exercise, especially if you have a leaky bladder.
Yes.
So that's what we're going to be doing tonight, ladies. If you have any guys on the call, you're welcome to listen, but I'm not sure how much you're going to get out of it. Just going to introduce Dr. Helen. She's actually a physical therapist, and her company is called MamaBear, which is so cute. But it's not just cute, it's really helpful because all the women that are mothers are mama bears, and we have to take care of ourselves so that we can take care of our children. So she's an orthopedic and pelvic health physical therapist. Now, I had never heard of this, and I was thrilled to meet her, and I asked her to explain more. So that's what I'm going to ask her to do. Tell us more about what she does and maybe where her inspiration came from. So take it away, Dr. Helen.
Thanks, Janet. So Yeah, pelvic health physical therapy is something that not a lot of folks have heard of. If there are gentlemen on the call tonight, everybody has a pelvic floor, so men are much less likely to have urinary incontinence. It's true, but you never know what could be going on with the pelvic floor. So pelvic health physical therapy, the best way I've heard it explained is just like orthopedic physical therapy, so muscles and bones, except in a small dark place. is kind of what the joke is, because the pelvic floor is just that, muscles and bones like the rest of the body, but it does have some very specialized things that can happen there, including, as you mentioned, you know, urinary incontinence, pain with sex. It has so many very, very specialized functions. Sorry, my marker board just completely fell off the wall.
Must be the
I
heat.
think so. I think so. So, yeah, so it has some very specialized functions, and therefore it is considered a subspecialty of physical therapies. So basically, I can treat everything from your lower back pain, shoulder pain, twisted ankle, to pain with sex, difficulty urinating, leaking urine, all types of stuff going on, even constipation with the pelvic floor. So the pelvic...
Interestingly enough, I bet a lot of these things intertwine. Yes. Because when one thing is out of line in the body, so many things go out of line. I had some physical therapy because I have an arthritic hip. And boy, was it affecting my back, and you would not imagine that it was. So between physical therapy, and I didn't know you, or I would have been coming to you, between physical therapy and massage and some good bike riding, we managed to alleviate what we were trying to do.
Yeah, absolutely. And it's a great point, because the pelvic floor is actually kind of part of that complex there, with the hip and the lower back. So sometimes we get folks who have, you know, an arthritic hip, and because the muscles in that area are trying to guard and keep that hip safe, then we end up with some tension in the pelvic floor also. So just to kind of give an illustration a little bit more about what I'm talking about, this is Priscilla. She's my good friend.
Hello, Priscilla with the tomatoes.
So this is a pelvis. Obviously, if you're looking at someone from the front, and this hodgepodge of stuff inside is your pelvic organs. So we have the bladder. This is the uterus. This is a female.
Hold up a little higher, because we're not seeing. There we go. I thought there were tomatoes. Okay. Sorry, you know how food oriented we are.
It does look kind of like a tomato, but it's actually a uterus. This one's a female pelvis, and this is the rectum. So those are the three organs that are considered the pelvic organs. And so everything else that's red and left here is muscle. And you can see this would be as if someone were laying down and you were looking up towards their pelvis. So here's the vulva, here's the anus, and again, all this red is muscle.
Wow.
So you can imagine that just like any other muscle in the body, it could be short and tight, it could be a little less strong than we'd like, and it has some really important functions. So of course that can cause some issues. So some of those functions are, it helps maintain continence, which is what we're going to focus on tonight, right? So we have a couple ways that it helps us to hold in urine, feces, and gas. Actually, those are three different types of continence. So it has these deeper layers of muscles here, which again, we see if you're looking from the head down, this is the bottom of the spine. These deeper layers hold those pelvic organs that I just took out in place. So they're not, your bladder's not kind of like sloshing around as you're jumping, running, coughing, sneezing, you know, especially running after kids in a playground or something like that. And then we have these more superficial muscles, so the ones closer to the skin here that have more of a sphincteric function. They're that last line of defense, and they squeeze tight to help prevent leakage.
So how does the bladder incontinence happen?
Yeah, so this is a great question. So there, like I mentioned, there's two different components here, and kind of both of them need to be not up to snuff for incontinence to happen, which is that usually the bladder is not irritating to the bladder, and the brain kind of feels like it needs to empty it. And then also we have these sphincteric muscles. So if those aren't tight enough, if those aren't able to contract enough, then we get that leakage. That can be anything from a couple drops with a sneeze to, you know, fully emptying the bladder with an activity. And what happens?
So it makes sense if a woman had a baby, you've stressed those muscles, especially if you've delivered vaginally.
So interestingly enough, actually, the pregnancy itself stresses the pelvic floor because the growing weight of the uterus has to be supported by the pelvic floor. And there's some thought now that a vaginal delivery actually helped the muscles relax after being really tight for those, you know, 10 months of pregnancy. And that actually a cesarean might be an issue also because you didn't get that forced relaxation of the pelvic floor. And if the muscles are too tight, then instead of having this nice trampoline of support under the bladder, you get a brick wall and then every time you're doing something with downward pressure, such as jumping or sneezing, the bladder is going to hit a brick wall instead of a nice trampoline. So it can happen, and it actually is reported in young women who haven't had children. It's reported in older women who have had children, who haven't had children. It's actually very common, regardless of if you've had a child. Certainly that is a risk factor, but not the only way that it happens. And part of the reason it happens more in women too is because the urethra, so this little tube from the bladder, you can see in women it's very short and it's straight down against gravity, as opposed to in men where it's very long and circuitous because it has to come out of the body and then up and then down through the penis. And that's a lot more of a barrier for leaking.
Gotcha. Yeah. So once we have these issues, can exercise help? Besides the physical therapy that you are doing, I know you're going to give people exercises, but do you train women on what to do after they've worked with you and what type of exercise to even avoid if you needed to?
Yeah, absolutely. That is my number one goal, is to get people able to be physically active without me, because we know physical activity is the key to so much. It's the miracle drug, right? So yeah, and
I call it my drug of choice.
Exactly. It's the best high you could get. So that's absolutely my goal is for folks to go back to exercising. And ideally, once you've gotten the pelvic floor to doing its thing, then you can do any kind of exercise you want. But there is usually, I help folks kind of find a graded increase in things that are going to create that downward pressure that would cause, just like any muscle training program, right? You don't like go to the gym and immediately pick up the 50-pound dumbbell. You start with a 5-pound dumbbell, right, and then you work your way up incrementally. So similarly with the pelvic floor, we want to start doing exercises. First, we start in a position where you're not working against gravity. So laying on the ground, laying on your side, things like bridges, things like clamshells. And those are great for the glutes, which help support the pelvic floor, but also really nice because then you're not working against gravity. And then we work our way up to standing. Then maybe we do a little bit of like a bounce kind of motion. And then we work our way up to jumping, running, if that's something that folks want to get back to.
So if ladies are having some of these issues and they're not super extreme and they're not really ready to come to you, are there some things they can do on their own? Like you mentioned, bridges. I think a lot of women are familiar with that from yoga or even former exercise we used to do.
Yeah, I love bridges. The number one thing that I recommend is the other role that the pelvic floor plays is it plays a big role in breathing. So it works with the diaphragm as we inhale and exhale, so that our guts don't get squished every time we breathe, right? That would be really inconvenient.
That's good. Okay.
So the number one thing I recommend is a breathing practice, right? We read so much about breathing practices and how beneficial they are mentally, but also the physical act of taking a really deep breath and using the diaphragm to its fullest range of motion gets the pelvic floor to move through a full range of motion also. So like I mentioned, we can kind of start to get that range of motion, get that trampoline action back for the pelvic floor.
So it's almost like you're massaging it with the breath, as they always talk about in yoga. Now, is there any way that we'd have to inhale, exhale, nose, mouth? Does it matter?
So my preference is to inhale through the nose. It's always beneficial to inhale through the nose because it's made to inhale, right? It warms the air. You have your cilia there. But my main concern from my perspective is the actual mechanics of the diaphragm and the ribs. So I like to see You know, you get coaching sometimes in yoga and other practices to do big belly breath, but I like to see a circumferential increase in the size of the ribs. So I want to see the ribs expand side to side and front to back. Oftentimes we miss the back portion of the ribs.
How do we know?
So
How
a
do we
nice
know
way
if
to
we're
do it.
doing that? Put your hand on your
So a
back?
nice way to do it, you can put your hands on your back, or you can put your hands around your ribs here and feel, you should feel breath
Expand.
going into your thumbs on your back and into the web space of your hand on either side, and then let it go.
Okay.
Yeah, and that gets the pelvic floor moving both through that relaxed stage and through that slightly more contracted, shortened stage, both of which are necessary for a healthy pelvic
And
floor.
how long should someone do that? For 2 minutes, or
I
is there a
usually
certain
suggest that
time?
people do 10 deep breaths because time is, you know, time's a hot commodity, especially if you're a mom. So 10
Maybe while you're
10 deep breaths a day.
watching TV
Yeah,
or
while you're
something.
watching TV or right before you go to bed. I prefer to do it in an upright position because then you're moving, you have gravity working kind of with and against you, which is more functional. It's more how you're going to be operating most of the time as opposed to a laying down position. But
Right.
yeah, and getting that pelvic floor moving through that full range of motion can be beneficial. I mean, it can even make you more orgasm more readily, and have sex be more pleasurable. In addition to helping,
Sounds like you're opening up the area.
in addition,
quite a
yep,
bit.
can help with the lower back, can
Instead
help
of-
with the hips. Mm-hmm.
Right, because and a lot of us are either sitting in a chair doing work, or we're even standing up like I am now at a stand-up desk, and we're never really resting that
Mm-hmm.
area. We're always putting that weight down on the
Mm-hmm.
area. So I like what you said about starting in what do they,
Mm-hmm.
supine?
Supine, you're correct, yeah.
Supine position, so that you can focus on those areas. And hey, what's a couple minutes if it's going to increase, reduce our symptoms or increase our orgasms? Let's go
Yeah.
both ways. So what other exercises can people
Mm-hmm.
do that are easy to explain?
Yeah, so another one that we give a lot, and it's kind of cliche, is the clamshell. And I think a lot of folks have seen that, where you lay on your side and you open your knees like a book. Well, you open your top knee like a book or a clamshell.
That works for my
Yeah,
hip.
exactly. It's great for the hips. And one of those muscles that does that action is actually right here and forms part of the side wall of the pelvic floor. So it's all kind of related. And the stronger the hips are, then the less stress the pelvic floor has to take, because it can be distributed through all the muscles throughout this area. Because, you know, outside, what you're not seeing here is, here are the glutes back here. Here would be your hip flexors and the top of your quads. Here are your abs. Here are your inner thigh muscles. So there's lots of muscles in the area that can help kind of offload. And that kind of also, one other point about the pelvic floor is it's the bottom of your core. So we all like to talk about strong core, do your abs, 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 abs. But if your abs are super strong, your obliques are super strong, but there's no bottom to your core, it's not that useful. So,
No
right.
foundation.
So
Right.
if you think of your core as a box, you'd have stuff falling out of the bottom of your box without the pelvic floor. So it's really nice once to practice that breathing, and then to be able to do that breathing while you're doing an ab exercise will help the pelvic floor be engaged during that ab exercise, whatever ab exercise it is, while you're holding a plank, taking those big deep breaths, you know.
Okay. So can our viewers look on your website and get some of these tips in writing that they'll be able to follow, whether they're going to come to you or not?
So my Instagram is the best place to find tips from MamaBear. We're just at MamaBear_PT. And I can link that too when we post in the comments. That's the place I share a lot of different exercise tips, breathing tips. And I will definitely share when I have more resources available on the website. It's in progress.
I will put that once we replay this video, I'll also put that in the comments so that people can grab it. I don't really see questions, I think, because the two of us are on, but if you see any, do you see any
No, I
questions
haven't
on
seen
your
any.
end, or you just see
Yep.
you and I? Okay, so it might be something, please, if you're watching and you want to ask some questions, ask them, or if you're watching this after and you want to ask some questions, go ahead and Dr. Helene will answer
Absolutely.
it. I'm not educated to do this. But I had another question. Did you have any more exercises, or can we move on to maybe how diet might affect
Yeah,
urinary
let's talk
incontinence?
about diet.
Okay. Okay.
So diet, one of the big things that tells the brain that we need to urinate, there are a couple things that will tell the brain that we need to urinate. One is if the bladder has filled up and stretched out the smooth muscle, then that stretch of the smooth muscle sends a signal to the brain, hey, empty us, we're pretty full. And interestingly, if you start to be very sensitive to that and urinate the instant you feel the urge every time, your bladder capacity will actually decrease. Your bladder will start sending the signal to the brain earlier and earlier. That wasn't a diet tip, but yeah, so you can actually train yourself to urinate more, to be more sensitive to urinating more frequently. So you should make sure that you like really need to go when you urinate. Random aside. But the other big thing that can tell our brain that we need to urinate is the lining of the bladder is sensitive tissue, similar to your stomach tissue, kind of. So if the urine that's in there is very acidic or irritating to the lining, yeah, then that can actually make you feel like you need to urinate, even if you've just, exactly. So it's kind of the same things you would think of when you think of heartburn are also bladder irritants. So carbonation, alcohol, citrus fruits, slow cooked tomato sauce, all the best things in life, you know. Basically Italian and Mexican food are just a zit. No. But
so will doctors that are working with you, whether they're your urologist or whoever you're going to, a primary care, will they mention any of this, or are they really not in tune to the diet thing?
Oftentimes they're not. I find that it takes a while to sit with somebody and talk to them about these things. So sometimes the physicians don't have as much time to do that. Or maybe they just aren't taught as much about it in medical school. I'm not sure, but most people who come to me haven't heard about this before.
Okay, that's my
but
question.
One thing I definitely also like to mention is that another thing that's very acidic is hyperconcentrated urine. So if you haven't had enough water, people think, oh, I won't drink water and then I won't have to pee. But your urine, when it's not diluted by water, will irritate the lining of your bladder and make you feel like you need to pee.
Okay, so we have to stay hydrated. Yep. If we're peeing very yellow, we know that we're not hydrated. Would you recommend at all water with like the not Gatorade, because I don't drink Gatorade, but with the electrolytes? Does that help anything at all?
To the best of my knowledge, it doesn't make a difference for urinary incontinence. But I mean, it's certainly helpful for other things.
Okay, so acidic is not good. Being dehydrated is not good. And then what you said about emptying all the way and trying to let yourself
fill up all the way. Yeah.
React to every single urge to go, because you're kind of like training your bladder to say, okay, go again, go again, go again. Yeah. It's probably a hard call.
Yeah. But, so it's normal to urinate about 5 to 7 times a day, and not at night or up to 1 time at night, unless you're act like pregnant right now, in which case the sky's the limit. There's no judgment there. But,
right. And do you find, like, I'm kind of pre-diabetic, so I'm always concerned about sugar. If I do eat like a dessert at night or have some alcohol, I find that I do wake up, and I'm assuming that I need to get that because your body gets rid of the sugar out of the urine. I'm assuming that that would have been an acidic conversation right there.
Yes, it's a combination of when you wake up during the night after having alcohol, it's the combination of the sugars finally leaving your system, also the nervous system having been dampened by the alcohol, and therefore it like overreacts. It kind of kicks into overdrive once the alcohol's out of the system, so that can wake you up too. And then also possibly the need to urinate. Yeah. So I don't tell folks that they can never have, like, I love a margarita. I'm not going to say don't ever drink a margarita. But no, exactly. But I just say, have knowledge is power. If you do if you find that you leak at night, then maybe try avoiding those things within 3 hours of going to bed. Or if you find that you really need to get a better night's sleep and you are waking up to urinate, then again, like maybe you try for a couple of nights, avoiding them 3 hours before we go to bed, see if it helps. If it doesn't help, knock your socks off. But if it does help, then at least okay, if I have this tonight, I know I'm probably going to need to wake up and pee. Oh, I have a big presentation at work tomorrow. I'm not going to have this tonight because I need a good night of sleep.
smart, lifestyle
Yeah.
oriented. So if somebody would work with you and do physical therapy, or any, physical therapist that's a specialist like you, are you actually helping to strengthen those muscles again and relax that pelvic floor so that your body can function more in synchronicity?
Yes. So I always look at the big picture first. Like, I watch people touch their toes and do a squat, and I want to see how things are moving together, because, like you mentioned, everything's connected. So if the upper spine isn't moving as well, because most of us sit at our computers like this all day long, I'm guilty of it for sure, then as we both sit up a little taller,
You made me stand up.
then more of the stress is going to go to the lower back and the pelvic area. So it's all connected. And so that's what I do first, is I look at the big picture, and we get the big picture moving as well as we can. And then we get into the nitty gritty of relaxing and contracting the pelvic floor. We may also spend some time on things like learning about bladder irritants, or learning how to control, if you have the urge to urinate 20 times a day, what do you do? Because you can't just go cold turkey.
Am I still there?
You just went black.
Can
I can hear you.
This is so strange. Well, I'll just keep going because you're important, but you can hear my voice. Yeah, that's pretty annoying. So I forgot to mention that your practice is totally virtual. So people can work with you from anywhere, whether they're local, you were in the New York City area, now you're in New Jersey. But even if they're in Florida or California or whatever, you can do some virtual coaching. And I'm sure if they set up a call with you to find out more, they could do that. You can still hear me, right? I don't know what's going on. It's so strange. I was trying to see if there's anybody on, but that didn't do anything. As long as you can still hear me, that's good. Is there anything else that you'd like to give as far as tips? I think you gave us a lot of tips so far.
Yeah, I mean, I think that the biggest takeaway oftentimes is just that if you are having something like leakage or pain with sex, it's common, but it's not normal. It's nothing to be ashamed of. And there you are.
Well, you know what? It's reversed, which is really strange. So now you're seeing my cabinet. That happened before too. So maybe I should just point it on something interesting rather than, here, we'll get a pretty picture.
Yeah.
How do I turn this thing around?
There should be a little camera thing on the top right that has little circle arrows in it. Hopefully. I have it on mine.
Yeah.
Anyway.
It doesn't, but what I'm going to do is I'm going to put the actual vitamins in front of the camera so you guys can see. That's just the computer. You had mentioned, you can see me in reflection. How funny is that? You had mentioned that CBD might be a good help for some of the anxiety. Can you speak to that just a little bit? Because I've never heard of this for the pelvic
Absolutely.
floor.
So I certainly it's outside of my scope to recommend CBD. However, CBD we know helps with anxiety. A lot of research has shown us that. And anxiety, interestingly, as a society, we tend to anxiety, digestive system, and our backs. If you think about even our vernacular around anxiety, stress, it tends to be, it was a pain in the neck, it was a pain in the butt, it was a pain, like I broke my back to do this. So we tend to somaticize anxiety and stress to those areas of our body a lot of times, which is why heartburn is so prevalent, and also things that are symptoms of a tight pelvic floor. So oftentimes if we address the anxiety and stress component, that can also have repercussions for the physical manifestations of that, such as a tight pelvic floor. And like I mentioned, if the pelvic floor is tight, then you've got that brick wall phenomenon going on.
Okay. We also have a stress spray. I'm sold out right now because it's a pretty popular supplement. It has B vitamins, and it also has some proven herbs that help with stress. So if somebody doesn't want to use a CBD, I find almost the same support in either one. If I've drank too much coffee or I had too many calls one day, I could spray the stress spray and feel the difference within a couple of minutes. Everybody's different, depends on what you're deficient in. The other spray that I'd like to recommend, since our #1 seller for all women, is the sleep spray. And I'm sure you know why. Unless you have a newborn and you don't want to sleep through the night, you want to make sure you hear that child. I think I had twins and they were preemie, and I never would have taken anything because I didn't care if I even slept the whole night because I needed to get up. They had heart monitors on and the whole thing. But of course, check with your doctor. If you're breastfeeding, check the ingredients. We can send you the label. But it's really important in general to get a good sleep for your whole health, for your immune health, for your cognitive health, you know, just to stay sane, actually, as a mother, especially, and if you're working. The last one I wanted to mention is we just brought this into our line. It's kind of an interesting, it's called CalMag. No, it's hard to see. My lighting's not that great. It's called CalMag, but there's not a high dose of calcium and magnesium, but they all come from natural herbs. Which you never see. You see all this rock calcium and rock mineral because, I mean, rock magnesium because minerals are rocks, but you don't really see, I have never really seen supplements that they don't have a high dose. Like I said, you still need to eat things that are going to give you magnesium and calcium, but it is a nice support for relaxation because calcium and magnesium do help you relax. Sometimes I'll just take magnesium at night before I go to sleep just to unwind.
And I often recommend magnesium for cramps. For folks who get a lot of leg cramps, magnesium can be really helpful, both orally and topically.
And calcium. So this might be a good daily kind of thing for people who are getting cramps, along with their other vitamins. I'm not telling you not to take calcium, but it is a nice support for bone and all that. Let me just see if I had anything else that I wanted to review. I did mention that your practice is virtual.
Yes, thank you.
You're welcome. The D3, I went over some of the products in the beginning, so I'm not going to go over them again. If anybody has questions, they're welcome to reach out. Support at SpectraSpray. We also have a Super Mom kit that was created by the Pickup Line newsletter, and it's a sleep, a stress, and a sanitizer. So it's the 3 S's, and the sanitizer is actually an essential oil sanitizer.
Lovely.
So there's lavender, there's citronella. The alcohol is the right amount, but you don't smell it like a lot of those really, really gross sanitizers. So you can spray it on your hands, you can spray it on your steering wheel. They've kind of proven that the virus doesn't really live on surfaces as much as they thought, but you still want to, you know, wash your hands and use hand sanitizers on your hand. And that's all I have for my products. But I just want to make sure that, you know, women are always checking their vitamin D levels, whether you're taking my products or someone else's. Make sure those D levels are getting up. If they're not, then you may want to try a different one that maybe absorbs better. And we do have a special code. If you're watching this in the next week until Mother's Day, you can use MOM10 and you will get $10 off your order. Even if you're not a mom, you know, if you want to tell your husband to go use the code and buy it for you, you can. So in closing, I'd really like to thank you, Dr. Helen, for taking your time. I know you're extremely busy and helping a lot of women. At SpectraSpray, we have a passion for educating, and we seem to be gearing a lot more lately towards women because we typically hold up the fort. Hopefully there's no guys on the call. But, you know, they say if mama ain't happy, ain't nobody happy. So, I'm sure you've heard that one.
Yes.
And it, you know, once you do become a mother, you'll totally get it. It's really important to take care of our health. And some of the personal issues that we have, there are people that you can speak to and get help from, like Dr. Helen. Do you have anything else to say for us?
I really appreciate being here. I always love spreading the word about pelvic health because, like I said, it's often stigmatized or seen as taboo, and I think that needs to change because it's so common. So let's all share our stories. You know, I do have a little guy who's 18 months, so I'm very intimately familiar with with the postpartum period.
No sleep spray for you. You got to wake up if he's teething or whatever.
Yeah, he's a pretty good sleeper. I'm lucky.
What's your Instagram handle?
It's
again?
MamaBear_PT.
Oh, that's easy. MamaBear_PT. Yep. You ladies can get some tips there. If you need to communicate with Dr. Helen, feel free to. We didn't do this to sell anything. We're really working on educating. Yes. And if you need referrals to other people, whether the nutritionists or dietitians or primary care or integrative primary care like I go to, we're always happy to share the resources that we